This is an overview of how to request investigations in a hospital setting so that you can ensure that your patient is seen quickly and that appropriate tests and investigations are requested. In general, the sort of things that we request are laboratory tests, so blood tests and tests from microbiology. You will be requesting things from the blood bank, so blood products such as red cells and platelets, and it's very important that you ensure that the correct patient details are on this request. You'll also be requesting reviews or consults from allied health professionals, so the physio department, social work, OT and dietetics. In some hospitals these requests will be made on the computer system, and in other hospitals they will be made by completing a request or referral form that's usually found on every ward. You'll also be requesting consults from other teams, and this is something that you'll be doing quite a lot. And again, this may be via paper or a short form, or it may be on the computer system. In general, if you request a consult from another team, it is better to follow that up with a phone call to the team as well to alert them to this. You'll be requesting images and investigations and different types of treatments from the radiology department as well. So as previously mentioned, there are different ways that we request things depending on what hospital you're in. Some of them are handwritten forms, and in some hospitals there may be a routine 9 to 5 form, and then at the weekends and after 5 you may be asked to complete a different form. You may also, in some institutions, have to handwrite in the chart or on hospital paper, and this would relate to sending consults or transferring patients. Most of the time, requests and investigations are done via the computer system, but again, if the test is, if what you're requesting is either a consult or a very technical scan or a procedure from the radiology department, you will need to follow this up with either a face-to-face conversation or a telephone call. Finally, some important information. When you are making requests, obviously the patient's details should be accurately completed. If it is a form that you're filling out, make sure, and you're using an addressograph, make sure that the addressograph is placed on all of the carbon copies of the form. You should include details of the patient's diagnosis and the reason that you're requesting this information or investigation or consult. If you're ordering or requesting weekend bloods, just remember that a lot of hospitals don't have weekend phlebotomy, and if they do, they are there only for a limited time. So if there's a large amount of blood requests made, it usually falls to the intern to carry these out. So ask yourself, does this patient really need this test done on the Saturday or the Sunday, and will somebody look at the result? If nobody is going to look at the result and it's not going to make a difference to the patient's management, then do not request that test. So it's very important, and when you're requesting urgent or emergency bloods or weekend bloods, that you document the reason and that the result will be checked. Be very careful when you're requesting blood products and that you complete the patient details accurately, and you do these at the patient's bedside and you confirm and check it. For radiology, it's a good idea to write your suspected diagnosis, as it focuses the radiology's, the person reporting, the radiologist, it focuses their attention on specific areas. Microbiology, when you're completing those forms, it's important that you write the patient's suspected diagnosis, the antibiotics that they are already on, and include if they have any allergies. As regarding consults or sending consults to other specialties and teams, try and include the patient's name, the consultant's name. Sometimes very large teams like cardiology or orthopedics, the individual consultants rotate doing consults, so somebody may be on consults for 1 month and then on consults for another. So find that out from the team, and when you're sending the referral, send it to the appropriate consultant on that team. Make sure you include the patient's details and the reason that you're requesting the consult up front. So don't start the consult with a whole load of information about the patient's background and reason for admission. Start with why you want that team to see the patient. Then you can include the patient's background and why they are currently in hospital. When you're requesting consults, you should contact the registrar on that team, ask them which consultant is on consult, and also ask them what investigations they would like done before they'll come to see the patient. So there's usually a set of investigations that specialists would like. If you're requesting cardiology, they may want ECGs, stress ECGs, echoes done in advance. Medicine for the elderly usually want quite a lot of blood testing done, and they may want a CT scan of the brain. So the best way to get your patient seen quickly and dealt with efficiently is to have all of these investigations requested and the results contained in the consult, and that makes it much easier for everybody, including the patient.